This Zoom replay video was originally streamed summer 2020 and is a part of the Tibet House US Menla online offerings. To learn more about upcoming retreats in person and online, please visit our website at menla.org.
So this talk is psychedelic-assisted therapy in contemplative practice for healing. As I said, this could go in a lot of different directions, so I have notes to try to keep me on track. Those of you who've seen me know that I can get a little off track, right? So I have slides for guidance. I am Elizabeth Nielson. I am have a doctoral degree in clinical psychology. I am the co-founder of an organization called Fluence, which is a psychedelic education program. Tell you more about that in a minute. By way of background, after completing my doctoral degree, I did an NIH-funded postdoctoral fellowship in specifically in drug use research, and completed that a couple of years ago. I've also had roles in directing education and training programs, specifically with the Psychedelic Education and Continuing Care Program in New York, which is part of the Center for Optimal Living. I have been a clinical research therapist and part of the clinical research teams at NYU, New York State Psychiatric Institute, which is also New York City, as well as part of the MAPS research team in New York. That's the Multidisciplinary Association for Psychedelic Studies. So I've been involved in a whole broad range of projects in this field of psychedelic-assisted therapy. One of the roles that I have in the world of clinical psychedelic research is providing training for therapists who are going to be doing that work in the research setting. Mostly we're working with treatments that aren't available outside of the research setting, but I'm one of the people that provides training and mentoring for therapists that are working in those on those projects. I'm also doing a study at NYU which involves interviewing people who have come through psychedelic-assisted therapy protocol and learning from them about their experience and what their subjective firsthand accounts of their experience is. So I am really full-time in this world in a lot of different places, and I know that there may be some of you here who are involved in certain ways in this field, maybe in some aspects of different projects, and this can look like quite a lot to build, but this is building for several years now. So it started small. It didn't stay that way. So I recently also, in addition to these things, founded an education program with my business partner, Ingmar Gorman, who is another psychologist in New York. And this is a photo of us last year in Montreal when we were allowed to travel. We were at this was actually at an open public evening on the campus of McGill. And the fellow introducing us in the jacket and the jeans is Joe Flanders. He's the director of Mindspace Wellbeing. Mindspace is a psychotherapy clinic that had brought us there. They focus on mindfulness-based practices, and they had brought us up there to teach a weekend training workshop. And I wanted to post this because our work with Joe and with Mindspace really, for me, began to help solidify my discussion of the role of contemplative practices and meditation in psychedelic-assisted therapy. This was, for me, a bit of a turning point where I had, thought a lot about it and trained a lot in psychedelic-assisted therapy, as well as in mindfulness practices and contemplative practices, but hadn't really begun to articulate how I would see the bridge between those things. So this has some significance, as well as just being kind of a nice shot to introduce us by. Anyway, that's me. That's my business partner, and that's Joe from Mindspace. So the reason we started an education program in psychedelic-assisted therapy, and we don't teach psychedelic-assisted therapy at the moment. We're gearing up to, but we're teaching a lot about the psychedelic-assisted therapy models and world and background and research that's going on. We don't actually teach the technique yet because it's, again, not available to do outside of research studies at this time with MDMA and psilocybin. The reason that we started working with this in this paradigm was because we really wanted to address the need for training in this area. A lot of professionals are interested, a lot of people are interested, but there weren't really a lot of opportunities for people to get professional education in this field. And those opportunities that there were available were really limited to people who were already in positions of power and authority, and in the existing institutions and in the existing field. So we really wanted to open things up. We wanted to create and enhance diversity in the field, and in doing so, create programs that would be more accessible, more available to people without necessarily having an affiliation with a research site or an institution, to be able to get in and get some, at least just some basic orientation to the field. We know that we know that there are huge disparities in the available healthcare and quality of healthcare, with disproportionate care being available to people representing marginalized groups. And so part of our effort to create training programs that are more open and accessible to people is a way of bringing more opportunities in so that there can be more diverse representation among various at various levels of work within the psychedelic-assisted therapy field, and also within psychedelic healthcare in a broader way. So we just started this work a couple of months ago. Really, we're doing the most that we can. We've been working a lot on credentialing and establishing a diversity fund and things like that. You can find out more about us at our website. The link is at the end of this presentation. So one of the things that we do in our trainings always has been to incorporate meditation and other contemplative practices into our trainings and retreats. So tonight I'm going to give a little bit of background about the relationship between psychedelic therapy and contemplative practices, and why we include those in our trainings about psychedelic-assisted therapy, right? And why we talk about them in our work and how we talk about them in our work. So for that motive, I'll tell you that in addition to my background in psychology and clinical research, I also have a background in meditation and some other contemplative practices. I spent a lot of time in school for psychology. And the whole time, I was really curious about how I could learn from and explore my internal subjective experience, but there was hardly any mention of this in psychology school. There was a lot of stuff that was like theory and ethics and history and diagnostics and statistics and social psychology and practice issues and more statistics. And it all seemed a little bit on the concrete side to me, and maybe even a little bit superficial, some of it. It wasn't really touching on what I was looking for personally. And I didn't find what I was really interested in until I wandered away from my training site in New York City, down the street to New York Insight Meditation Center, which some of you are probably familiar with, and signed myself up for a weekend non-residential retreat. I had no idea what I was getting into, but I knew that I was headed in the right direction. And from there, I began to study more and more meditation and get instruction and develop a practice. And over the years, because I was already so far along in the psychology world, it didn't make sense to drop out of school and meditate full time. But I was able to start bringing a lot of meditative practice and meditation informed therapies into my practice of psychology. So I got trained in mindfulness-based stress reduction, mindfulness-based cognitive therapy, a lot of things you've probably heard of, and really started focusing on the ways that my meditation practice and the teachings of that could inform what I was doing as a psychologist, as a therapist. So this became part of the story of getting involved with psychedelics. I wasn't actually looking to get involved with psychedelics, but several years later, I had the opportunity to get involved with a clinical trial of psilocybin, and I, joined a training team and thinking, okay, this will be a really interesting project. I understand this. I'm very interested in, helping to find better and more better empirically supported treatments for this cause specifically, for this diagnostic category, and very interested in the whole idea of working with psilocybin and kind of turning the paradigm of a drug that's been thought of as a drug of abuse back into and using it in a way that's therapeutic. Very interested in all that. And after several years of working in this, I began to notice that the actual practice, the actual meditation practice, and the frameworks that I had learned about that practice and those experiences were really of immense benefit in seeing my patients through their experiences of psychedelic-assisted therapy. And this held true over the course of several different types of experiences and trials. It wasn't just like one thing, but I really started to find this incredibly valuable, and in ways that I hadn't really imagined that I would. So I'm going to backtrack a minute, because I could go along pretty far out along that limb. But let's backtrack a minute and start and talk a little bit about what are psychedelics. What do I mean by this? Because it can mean different things to different people. So it's good to clarify this. Psychedelics is a word that means mind manifesting. It's usually used to describe serotonergic hallucinogens, things like LSD, DMT, psilocybin. These are all a sort of family of drugs that have similar pharmacological properties and subjective experiences. They vary greatly in intensity and duration, but they've got some similarities. The word is also used to describe things like mescaline and ibogaine and 2CB and ketamine and MDMA that have different pharmacological properties and different mechanisms of action and different subjective effects, but it's an umbrella term for compounds that alter our sense of perception, our sense of who we are, our sense of time, our sense of ourself in relation to the world, and are many of which are or can be used in a psychedelic-assisted therapy paradigm, right? Where you're using that experience as part of psychotherapy to help work with some kind of psychological difficulty or diagnosis. So we're going to move on to that in just a moment. But there are a lot of words to describe subsets of the psychedelics category. And you may have heard some of these, like psychotomimetics, which references their purported ability to bring about a psychotic or a psychosis-like experience. This was an old model that people used to use psychedelics to try to study what that experience might be like, or to try to experience something similar to it. Hallucinogens is the word used in the DSM, Diagnostic and Statistical Manual. I think it's a bit of a misnomer, because most of these things don't really create hallucinations. They create more like perceptual alterations, illusions, and things like that. But that's the term that's associated with the more medical end of this spectrum. But what these have in common is that many are, another thing they have in common is many of these are naturally occurring compounds or based in naturally occurring compounds. And many of these are derived from plants that have associations with indigenous use, with shamanic use, with ritual or religious use. And in some cases, it's important to mention, in some cases, the prohibition of these substances is at least partly related to the oppression of indigenous communities. It's not, our system is not separate from that, right? The scheduling and prohibition of these drugs is not based necessarily in scientific research about their actual dangers, but it's based in social and political context, which includes efforts in that direction. And we also have additional associations fueling their prohibition or their restriction. For instance, association with counterculture and anti-war movements of the 1960s. So there's a lot of social and political associations that people make with these compounds, and then in that in the trajectory of that has come and came for a long time a lot of stigma about these drugs, which really kept us from having an open dialogue about their potential benefits, their actual risks, and how they might be used in a therapeutic paradigm. So that's all kind of background stuff. I'm not going to dive too far into that history, but just know that these can be tricky topics, and they can really bring up a lot of associations for folks. And we're not working in a world that's free of any of that, right? In fact, we're working very much in that context. We all have some knowledge of these drugs. Like, we've all heard of them. We all have some association, even if we know them only as illegal drugs. That is rooted in our cultural context. Okay. But what do we know else about how we define them? That's not the only thing, right? One way that we could talk about psychedelics is to talk about them as compounds that can facilitate the process of examining one's inner life. They can make the experience of one's inner life more accessible. They can inspire fascination with the nature of the mind, with the limits of perception, with the very experience of the self as a fixed, stable thing, right? They can cause a questioning of beliefs or of just assumptions about the nature of reality and about constructs that are often taken for granted. And just by having people experience things differently, right? It's not necessarily an idea that has to be planted, but just people experiencing things differently can cause some questioning of, by extension of that. For instance, the construct of time is often experienced differently while people are under the influence of a psychedelic, especially the classic psychedelics or serotonergic hallucinogens, but many others will do that as well. And while many of us have, for instance, an intellectual knowledge that the idea of time is an illusion, the physicists tell us so. We just know that because the physicists tell us so, right? We might even think it's kind of funny because we're always trying to get somewhere on time. But experiencing it as such is really not so readily accessible for the untrained mind or the, not advanced physicist thinking mind, right? So just having that experiential knowledge of something gives people a basis for sometimes extending that questioning and extending that ability to think in new ways about things, right? See themselves differently in relation to things. So you're probably hearing a lot of things that sound like they might be of interest from the perspective of a meditator. We saw a couple people here who said they heard about this through Menla. I'm going to presume that some of you here have a meditation practice of some kind. Any kind is great. I'm not partial to any particular type, but if you have some meditation experience or you're interested in having some meditation experience, you might be hearing some things that sound a little bit like they could be of interest, right? Like, isn't that what meditation is about? That getting beyond the limits of perception and digging a little deeper into the experience of the self. And wait a minute, could psychedelics help with meditation? Well, maybe, but that's not what I'm going to talk about. There is, however, a really interesting body of research that I encourage you to check out about overlapping experiences, psychedelic studies that have been done with experienced meditators, with meditators who are actually on retreat, and looking at some of the overlap and not just experiential overlap, but actual with neurological measures and brain imaging studies. There's some really interesting stuff in that direction, but that's not quite where I'm going to go. I want to tell you about psychedelic-assisted therapy. So psychedelic-assisted therapy is a model of using one to a few, sometimes 2 to 3 full dose psychedelic sessions embedded in a variety of models of therapeutic support with the goal of treating a specific profile of symptoms, a specific syndrome related to a mental health diagnosis or problem. Okay, so for instance, psilocybin-assisted therapy for alcohol use disorder or alcohol use problems is being researched. And this involves 12 weeks of psychotherapy focused on alcohol use and problems and preparing for the psychedelic sessions, and then supporting people through those sessions, and continuing with psychotherapy with another set of sessions embedded therein. The graphic here comes from a paper on which Alicia Danforth, a researcher at UCLA, was a lead author, but I've chosen it simply because it's a beautiful little illustration of the progress of therapy and the sort of timing and spacing of sessions. And you could think of it as being like each of these bars being approximately a week apart. So you may have several weekly preparation sessions, a psychedelic session, several more weeks of sessions to integrate and work with that experience, and then another psychedelic session. So we're not talking about daily dosing schemes. We're not talking about ongoing use of the medication. We're talking about a few acute, intense experiences embedded within a longer framework of what's really a brief psychotherapy intervention, right? And these models vary widely between different protocols, and it's all, mostly research stage stuff right now, but this is like a pretty typical one. So psychedelics can be used in lots of other ways, in lots of other settings, and for lots of other purposes. They can be used in ceremonies, they can be used in festivals, they can be used sometimes with peer groups or on one's own. Whole variety of motives, reasons, intentions, and things. But when I talk about psychedelic-assisted therapy, this is what I'm talking about: a clinical care model. There's a diagnosis, there's a therapist, there's a patient, just like regular psychotherapy. You've got that container, you've got that clinical outcome that you're looking for, right? So why am I talking about this? Does psychedelic-assisted therapy involve meditation? Well, that kind of depends on who you ask. Because from a meditator's perspective, I hear a lot of things that sound pretty familiar. It depends on what model is being practiced, and it depends on what the focus of treatment is. But most modern protocols that I'm familiar with involve a few sessions of preparation where people are actually asked to practice or plan to practice or plan to engage in introspection during their psychedelic session experience, right? And by this, I mean they're asked to focus on their internal experience, at least to the extent they're able to during the session. They're provided with an environment that's conducive to this. It usually includes a comfortable place with eye shades and headphones and the presence of their therapists to kind of keep them safe and attend to their needs for the day, so they don't have to worry about the outside world, and it really limits interference or the need to engage with others outside of the session. And when I first heard the instructions that were being given, and we began to hear the instructions that were being given at the beginning of and leading up to psychedelic sessions in psychedelic-assisted therapy, I was thinking, wow, this is really similar to the instructions that we'd give somebody for a meditation retreat, right? Turn off your cell phone. Don't need to, call the outside world. Notice what that's like. Maybe, close your eyes, or maybe soften your gaze so you're not taking in so much visual information. You're not engaged in talking with others, which means you're not engaged with conjuring up a sense of who I am in relation to you and navigating all the stuff that goes with that. You're really asked to tune into what's going on in an internal way. So I saw a lot of similarities, a lot of overlap. There's a safe container, and there's this encouragement and support. And on a meditation retreat, it's from the teachers and the Sangha, and in a psychedelic session, it's from the therapists as well as the study team that's kind of there in the background, but not necessarily in the room. There's this environment of social support and dedication to this process, right? Everybody's valuing this process, and the person is asked to engage in. So clearly, in my mind, there's some overlap here in the direction and perhaps similar value found, across across some of these practices that there's some shared instruction, there's some shared value. But I don't want to, suggest that the subjective experiences are the same or that one is interchangeable with the other. That's not where I'm going at all. I want to make that very clear. The subjective aspects and the experience of both meditation and psychedelic therapy have incredible variation within groups. And, there is not just one meditation practice or just one type of psychedelic session. But we do see some potential for conversation. We are talking about two very different and not interchangeable practices. So making that really clear. Now, but this experience has led me to believe that contemplative practices such as meditation can be of interest in the preparation for and support for integrating psychedelic sessions and for working with that material. Now, again, there's a variety of ways I could go with this, but I'm just going to pick one. The thing that I really want to talk about tonight, and this is kind of the key, getting down to the key point here, is that the value for psychedelic therapists in having a contemplative practice and having experience with a contemplative practice. Now, there are a lot of people who in the field who talk a lot about the value of psychedelic therapists having their own experience of psychedelics, and that is a completely different subject than what I'm talking about. I'm not going to go into that subject right now. I'm not going to I'm not going to justify it or defend it or explain it or dispute it at all. That aside, I want to suggest that there's a different set of skills that also have value that may be very important for psychedelic therapists that could be acquired or developed through contemplative practice. And the contemplative practice offers not just not an alternative to having a psychedelic experience as a different way of having a non-ordinary state of consciousness experience, although it does and it can be that, but that it also offers some skill development that I think can be very important and relevant for psychedelic therapists. So a couple things that might help with are developing the capacity to maintain attention and awareness during 8-hour sessions. Most therapists are pretty well practiced at developing attention and sustaining their presence with someone for 50 minutes, maybe 45, occasionally 60. 8 hours is a whole different thing. So this is something that I think meditation practice, especially retreat practice, can really come in handy for. Developing attitudes of openness and curiosity towards one's internal experience so that these can be embodied and modeled, not just taught as concepts. These are all really based in my experience and theoretical development of this idea, but it's really different to explain something to someone like the concept of being open and curious towards their experience versus to practice it oneself towards one's own experience right there in the room. And meditation experience can teach us just how much we are heckling ourselves, right? Anybody ever gone on retreat and just sat there and heckled themselves all day or, given themselves a hard time about something all day? It can really, really illuminate that process. So when we have that experience, we may better be able to to keep those attitudes towards ourselves, which can make them easier for others to practice right along with us. And I think it can also help us to develop a capacity to hold a steadiness of awareness through a really wide variety of internal experiences. Again, lots of psychotherapists get therapy, but that doesn't necessarily give them practice in maintaining a sense of being aware of what's going on in their internal process and not being completely thrown off course by it right in the moment. Okay, so it gives us a sense of what might we find in there, what might we expect, and how to stay stable through and weather some of those storms. Okay? But these are some of the basics. It's not quite what I wanted to get to. The thing that I really want to suggest is that meditation practice Contemplative practice and the Buddhist psychological framework in which it's understood offers a framework for understanding the nature of self that kind of goes beyond what most of what is taught and understood in traditional psychology and psychotherapy training programs. You remember me talking earlier about my experience in psychology school, right? And not finding what I really wanted, which was some education about the nature of my internal experience. And so I think that these practices and the contemplative practice framework, the psychology in which they're explained, really do offer something that's of value there. These psychology programs and psychotherapy programs, mental health training programs in general, many of them are wonderful, and they can provide an amazing education. They do tend to focus on a conceptualization of mental health that conceptualizes mental health as a healthy ego, development, and functioning. And what I mean by that is that pathology or problems are largely seen as a breakdown in the process of development. Somewhere along the way, something didn't go quite right. And that or an inability, a lack of enough strength of that ego to function and meet the demands of the daily stressors of life, or the extremely exacerbated stressors of life in instances such as trauma and more extreme situations, right? And healing is seen as the restoration of the healthy self, or the healthy functioning ego that's able to become stable and adequately integrated and cope with the realities of the world that we live in. So that's where, that's kind of the prevailing idea. There isn't really, except for some certain very specific schools, a whole lot of framework for understanding and working with non-ordinary states of consciousness experiences, such as those experienced during meditation and psychedelic experiences. Buddhist psychology, with meditation being the experience and practice of its principles, offers the principle that a fixed, stable sense of self is in itself a problem, and or leading to problems, or creating problems, or inherently will at some point if it's held too tightly, and is something to be moved beyond. And so it generally presumes a relatively healthy level of development if people are beginning meditation practice, although people come to meditation practice at all sorts of stages of development, and that's wonderful. Welcome where come as you are sort of idea is always supported, but it's not so focused on repairing ruptured developmental processes, but more on helping to move into a new stage of development beyond the stable, fixed sense of self, where we're able to let go of that idea a little bit, maybe loosen our tight grip on it, and sees that as even further development, further fulfillment along a trajectory. Just as it said, when we've crossed the river, we no longer need the raft. The self is seen as perhaps a vehicle to get to the meditation or to get to the practice, whatever that is, after which it becomes much less needed, or slowly, gradually over time, less and less needed. For most of us, this is not an either or a complete situation, but little by little steps in that direction, and that with each step, we are maybe experiencing less stress, less mental agitation, and more peace and ease in our lives. So meditation practice is there to help us understand and support this practice such that it proceeds along a healthy continuum of development. Now, since we know that psychedelics often occasion experiences of profound shifts in, or even the complete loss of, a sense of self, and that Western psychological models, most of them in general, don't cover the territory of this spectrum of development, or show us how to incorporate these kinds of experiences into our lives in meaningful ways. I would say integrate these experiences through practices such as embodiment practices, And, you know, the ones that come to my mind, there are many, but the ones that come to my mind are things like practices of generosity, practices of precepts, right? There are some standards for how to help work with those experiences in a real day-to-day life way. Just examples, but those are a few of them. I know there are many. It makes sense to turn to contemplative practices and to turn to this psychological framework and the psychologies from which they spring in order to better understand and help our patients develop the ability to navigate this territory, or navigate these experiences where they may experience profound shift in their sense of self. Help us figure out with them what to do with that, right? And the therapist's own model, the therapist's own contemplative practice can then become a model for assisting the patient in navigating similar experiences that psychedelics might occasion. So especially given that meditation practices are grounded in a theoretical framework that defines them and sees them as part of a healthy development, as opposed to conceptualizing them as another form of pathology or simply something extraneous. So I hope I've been clear. I'm going to take a couple of questions. I just want to say that, you know, by course of necessity, I know that I've left a lot of things out, but in this particular talk, you may have questions about things that are sort of beyond the scope here. And let's see what those are and where you've got to. And if the points that I have talked about here require further clarification, then we can certainly discuss and do that. How's that sound? I'm going to, how are we doing on time? Oh, that's kind of perfect. I'm going to stop my share. Oh, wait a minute. Hold on, no, I'm not. I forgot something. Never mind. That was the end, but I have one more slide that I want to share, which is this one. This is my thank you slide, but it's also my contact information. I want to make sure that you all have it so you can find us. That's my email if you want to rate me, and that's my website, which talks more about my work and about the educational offerings. We're not at the end yet, but I'll just go ahead right now and say special thanks to everybody at Menla, Tibet House, my team at Fluence, for your help and support of all of this, as well as the research teams that I work with, NYU, PI, MAPS, and all of the various funders of all of those various projects, most of which I've listed here. Thank you to my contemplative practice communities, as well as just say that, you know, I'm presenting my ideas here and they might be new or different. I really appreciate your coming out to listen and to engage in this discussion. But my ideas are mine and only represent what I've said. So not any of the other people, not necessarily the other people's views. All right, let's go to some Q&A. I'm glad we covered that because I know some people might want to cut out a little bit early. Do you want to leave it like this, or do you want me to stop the share?
Maybe leave it like that just for a minute so people can get information.
Yeah, I want people to make sure they get that. Yeah.
And some time to type some questions as well.
Great.
Right. So there is a question about accessing this kind of therapy or these kinds of resources, especially in the LA area, but is there a website to go to or a place to go to where you can find someone willing to do these kinds of therapies?
So psychedelic-assisted therapy with psilocybin and MDMA are only available in research settings right now in the United States legally. There are clinical trials going on in that area, though, so I would suggest, I'm just going to tell you the easiest way. On my website, there is a link for resources at the top, and there you'll see two links to explore for clinical trials. One is a website called clinicaltrials.gov. We've written some instructions for how to find psychedelic-specific studies. And then the other one is for the MAPS research. If you're interested in MDMA research, you can go there. and sign up, and they will do a pre-screen. And if you're eligible for a local site, they will connect you with that site. One way that psychedelic-assisted therapy might be accessible is by doing some work with ketamine. So you can search for ketamine therapy providers who actually incorporate the principles of psychedelic-assisted therapy into work with ketamine, which is available legally in medical settings. And there are some providers in there. I would suggest visiting the website KRIA, I believe it's KRIA Conference or KRIA.org, KRIYA. If you just Google KRIA, there's also a link on our website, but they have some great resources, and as well as provider directories.
Great, thank you, Elizabeth.
Sure.
Another one popped up. What is the recommended educational path for someone who wants to become a practicing psychedelic psychotherapist? Do you recommend PsyD or a PhD?
Right now, we don't know what the what regulations are going to require what kinds of education for what types of roles in this work. So there's no way to give you a definitive answer, like if you do this, you will qualify for that. It has just not been determined yet. It depends on what you want to do. I think, if your goal is to become a therapist and, be the main, really have the bulk of your time spent with patients, I generally don't recommend a PhD because you're probably going to learn about a whole lot of things that are going to be extraneous to that. I suggest a program that's going to focus more on psychotherapy skills, and definitely psychotherapy skills and work experience with the population that you want to work with. So for instance, if you're interested in providing MDMA-assisted treatment for PTSD, focus on finding a good program that's going to give you a background in other forms of therapy for PTSD and getting experience working with that population. And then, do the extra education to add the MDMA piece.
Thank you. Hope that answered the question there. Let's pull up another one here. Is there any outcome research that shows efficacy of this modality in trauma or in addiction?
So the status of research for post-traumatic stress disorder, there's a program of research called MDMA-assisted treatment for post-traumatic stress disorder. And that is in the middle of phase 3 right now. You can find published phase 2 results. They're very promising, but they're not big enough numbers to tell us, enough data for statistical differences and approval. And what was the second half of the question?
It was, is there any outcome research that shows efficacy of this modality in trauma or in addiction?
Yeah, so again, I think the largest study of psilocybin-assisted treatment for alcohol use disorder would be the one for any addiction in modern times, and there's a phase 2 study that is just being closed up now. So there's a pilot study of that. You can take a look at that. It was published, I think, in 2015 by Michael Bogenschutz, but it's a small 10-person pilot study. The larger trials are, they're underway. Some of them are starting to be closed out now. I expect we'll see more in the coming months. A really great way to find out sort of the latest about this stuff, we do post a lot of video resources on our website under the media tab, but if you also take a look at some of the major conferences over the last year that have posted videos, they have conference talks in which people people discuss, sort of the most up-to-date status of a lot of these projects. And you'll be hearing about these projects in that format years before they're published. So I recommend conference talks a lot. They're free, they're online, they're all usually on YouTube. And they can be a really fun resource. Plus you get to hear directly from the researcher telling the story about their research, which is sometimes more interesting than just reading the paper.
Great, thank you. That's super exciting. That's a great resource.
Mm-hmm.
Next one, got time for a few more questions.
Yeah.
What are your thoughts on increasing for-profit companies that are in this kind of space?
So there are a mix of companies that are in this space. There are nonprofits, there are B Corps, there are for-profits, there are small ones, there are big ones. There isn't necessarily, I don't think there's such a, it just necessarily needs to be such a line between the two. I think there's actually a lot of overlap in terms of what they can do and what their business practices are. Keep in mind, lots of nonprofits have to make something off their product to make ends meet just because they're structured as a nonprofit. Doesn't necessarily mean they don't need to, think about good business practices and sustainability. There seem to be a lot of new companies cropping up. I think it's really interesting. We'll see what happens. But, I tend to look at like who's involved, what's their level of, existing connection to the field and to the research, and things that they've sort of track record. What have they done? What have they achieved? And I think there's some great opportunity to create some sustainable businesses that can do quite a lot of good by being able to bring in a substantial amount of capital pretty quickly. If you look at the MAPS project, we're in the middle of phase 3 now. The campaign to do the research to get MDMA approved as a medicine started in 1986. So it's been slow. It's been difficult. Of course, it was setting the precedent along the way. It was a lot of firsts. But part of that pace has also been, dictated by the need to rely on donors for support. So there's nothing wrong with that. But I think that now that there are investors willing to support some of these projects and companies that are wanting to engage in them, that it doesn't make sense to have every project take that long because we're doing it entirely on donations. So I think we need a balance. We need a balance. We need a conversation, and certainly accountability and input from existing members of the field, existing people that are established, is always a good sort of way to round things out. Okay.
Great. Cool. Thank you. We have a few questions of kind of varying degrees about the states of consciousness, especially through meditation or through internal focus. So I'm trying to think of how to best ask the question, I guess. Can you talk more about combining the use of the psychedelic material with the meditation practice and how you can combine those to really help somebody go through different states of consciousness that transcend personal ego and the self?
Mm-hmm. Well, let me put it this way. If I'm seeing a patient in private practice who says, they're thinking about going to have a psychedelic experience, one of the first things I want to ask them is, well, have you tried any contemplative practices? Have you ever tried meditation or anything like that? And that can kind of be seen as a little bit of a proxy, right? So if someone says, I can't sit still with myself for 5 minutes, I, would say, okay, well, psychedelics can be a pretty intense internal experience. And it sounds like it's hard for you to go through whatever it is that happens when that, when you get, when you try to meditate. So maybe that's something we want to investigate a little bit more. Simply because, thinking of them as completely different, I think, it's nice to be able to, for people to be able to go into those experiences knowing that they've got some tools to work with potentially very bizarre, overwhelming, intense experiences, right? And those, that can be a good way of just gauging somebody's skill set for that kind of experience. Right.
Great. And then the follow-up question there would be taking that and applying it to the daily life outside of the therapeutic session. So how would you carry that forward into everyday practice or everyday thinking?
Right. So this is an interesting place because a lot of people, will come out of a psychedelic experience feeling maybe a totally different relationship to themselves, maybe having really experienced, their values in a different way, or feeling motivated to live in a different way and live with maybe more, in a way that's more aligned with their values, right? One word for it is to live with more integrity, but that feels kind of judgmentally, but I don't mean it that way. I just mean like wholeness and alignment with one's values. And so I don't know that our psychological practices are particularly great for that. Like we're taught to symptom reduction, right? But I do think that contemplative practices have a lot to offer in terms of teachings about like how to be in the world, how to be in relation to others, what kinds of things you might want to try or notice that could help you to live a way that's feeling more aligned. So I think that's a place that we really can turn to. What kinds of states of mind do you want to develop? Yeah, and I invite people to explore whatever practices are attractive to them, and some will gravitate towards meditation, others will not. That's fine. There's no prescription for it. But I do think that there's some value in looking at what are the kinds of things that are recommended for ways of living in the world for someone who's trying to develop a meditation practice. Right.
Great, thank you.
Yeah.
Very good answer. We did have a more educational question. If you are already a licensed therapist, how can you set yourself up to be a psychedelic therapist? Besides doing your own work, what specific models can you suggest?
If you're already a licensed therapist, so again, the only ways that this is legally available right now are with MDMA and psilocybin are in the clinical trials. And the only ways to get trained for clinical trials, by and large, a few exceptions, but the only ways to get training in the modality that's specific to the trials is to get trained for a specific research site. So if you can affiliate with a research site that's putting together a study and wants to bring you on as a therapist, that's one way. The therapist training is by and large not really available to the public yet. We do plan to offer some of it soon-ish, like within a year maybe, although it's not definite yet. There are some things that need to fall into place before that. There's a place in California called the California Institute for Integral Studies. They have a certificate program that does teach a lot of this, a lot of background and a lot of the beginnings of what one would need to practice psychedelic-assisted therapy. But again, I just want to say there's no established credential for this separate. If there is going to be one, it hasn't been established yet. So nobody can come out and tell you this is exactly what you need to do to be able to be practicing this 3 years from now. Just hasn't been hasn't been determined yet. So I'm sorry, I wish I had more to tell you. I wish I had better news, like sign up here. But it's not the case. I mean, my company offers training in psychedelic integration for clinicians that is aligned with and consistent with pretty much the main leading models in research, especially the MAPS model. And that's a great place to get started and a great place to be able to work with people who've had experiences in other settings. So that's an option that's available now and that can be practiced now. But as far as the actual psychedelic assisted therapy, yeah, for this kind of work, it's not really that available yet. But if you're here, you're already on the leading edge of the curve. So you are by definition an early adopter, because many people are not even really, this is not on their radar yet. So take heart in that.
Great. So everybody's in the right place.
Yeah, you're all in the right place. Exactly where you are.
So with just a few minutes left before everybody does leave, we'll get maybe to one more question, but I did want to thank everybody for joining us. From Menla, from Elizabeth Nielson, we are very grateful that you are here. You are the reason we are here. So thank you very much for being here tonight and participating and hopefully enjoying these teachings. I certainly know I did, watching along with that. That was incredible information, and thank you, Elizabeth, for sharing the cutting edge of where we are with these teachings and knowledge.
Yeah, please do join us. And we're going to have a retreat at Menla, hopefully in November. And it will be for people who are interested in exploring the role of contemplative practice in psychedelic and working with people who've used psychedelics for therapists.
This archive video was brought to you in part through the generous support of the Menla Tibet House US membership community and viewers like you. To learn more about the benefits of membership, visit tibethouse.us.